Hello, I'm Governor Mike Pence. From the outset of our administration, we've focused on improving the health and well-being of Hoosiers, our families, especially our kids. The truth is, Indiana's had more than our share of health challenges. Our state ranks 41st worst in overall health among the states, and in the bottom 10% of a number of health indicators. And sadly, we're 45th in America in infant mortality. That's why we've been taking action to improve the health of our people. We've fully funded our Medicaid program and undertaken a public education campaign to promote fitness, modeling that among our state employees. We've assembled stakeholders from across Indiana to tackle the heartbreak of infant mortality. And we've been proposing innovative Hoosier solutions for the uninsured in our state. Today in Indiana, we have some 350,000 low-income working Hoosiers, those below 100% of the federal poverty level, or roughly, for a family of four, that's about $24,000 a year, who lack access to the kind of quality health insurance that their better-off neighbors enjoy. Experts rightly call this the coverage gap, and it leaves people unable to get the preventive care that they need to keep small health problems from becoming big health problems. Now, as most of you are aware, the past 7 months, the state of Indiana has been discussing and debating the terms of a waiver from the federal government to close the coverage gap by expanding our own homegrown health care solution, the Healthy Indiana Plan. The original Healthy Indiana Plan, or HIP for short, was crafted more than 8 years ago with bipartisan support in our Indiana General Assembly. And it now provides health savings accounts and access to quality care to some 60,000 people, empowering them to become health care consumers. Now, because of this success, my administration submitted a waiver to the Center for Medicare and Medicaid Services in Washington, D.C. to replace traditional Medicaid in Indiana for all able-bodied adults with an updated version of the Healthy Indiana Plan. We call it HIP 2.0. It's designed to serve Indiana's working poor, and it's intended to give low-income Hoosiers the chance to purchase private, market-based health care coverage and control their own health care. Now, to get Washington to say yes to this plan, we've been working hard. I've gone to our nation's capital, engaged in hours of discussions with federal officials. I even took our case directly to the President. We fought for the right to expand access to coverage the Indiana way, through consumer-driven health care choices. Now, we were always willing to compromise on details, but we were never willing to compromise on the principles of personal responsibility that are at the heart of the Healthy Indiana Plan. Today, after 7 months of active negotiations with the federal government, I'm pleased to inform you that effective February 1st, the Healthy Indiana Plan will be available to more Hoosiers than ever before. The state of Indiana has reached an agreement with the federal government on our waiver. The Healthy Indiana Plan 2.0 has been approved. With this decision, our state can begin covering our uninsured working poor the Indiana way, based on personal responsibility and consumer-driven health care. Now, I've long believed that there are really only two futures in health care reform in America. There's consumer-driven health care and government-driven health care. That's why from the outset of our administration, we've been saying no to government-driven health care, like Obamacare, no to the state-based exchange, and we made it clear that we wouldn't expand traditional Medicaid in our state. Medicaid is not a program that we believe we should expand. It's a program we believe needs to be reformed. And that's exactly what we've accomplished with HIP 2.0. HIP 2.0 is grounded in personal responsibility and includes elements that have never before been approved for a program of this magnitude by the federal government. We're empowering low-income people to make better choices in their own health care. HIP 2.0 participants are required to contribute on a monthly basis to a power account, which they manage just like a health savings account, and are rewarded for using preventive care. Penalties for non-payment range from reduced benefits to mandatory co-pays for services and even a loss of coverage, which is a first in the nation for reform. In addition, the plan includes a $25 copay for non-urgent use of emergency rooms, again, a first in the nation. And under HIP 2.0, Hoosiers also will have the opportunity to use their health savings account to pay the employee portion of their health care costs, another first in the nation. HIP 2.0 also includes a work referral element that it offers enrollees the chance to gain new skills and learn about work opportunities so they can improve themselves and move out of the program. HIP 2.0 is not intended to be a long-term entitlement. It's a safety net that aligns incentives with human aspirations. And HIP 2.0 will be fully funded at no additional cost to Hoosier taxpayers. HIP 2.0 will be funded by a combination of federal funds and an agreement with Indiana's hospitals, who've partnered with us to improve access to health care in our state. This means HIP 2.0 will require no new state spending and no new taxes. Indiana is ending traditional Medicaid for all able-bodied adults and replacing it with the Medicaid reform that we call HIP 2.0. The start of HIP 2.0 not only means the end of traditional Medicaid for non-disabled adults in Indiana, it also means improving our base Medicaid program serving the aged, blind, disabled, and children, because we're increasing the reimbursement rate to healthcare providers and thereby increasing quality and access to care. And the good news is, HIP 2.0 is ready to go. We'll begin taking applications immediately, and coverage will begin February 1st. Family and Social Services Administration has been working for months to make the system changes necessary to implement HIP 2.0 and has trained its eligibility workers to be ready to begin helping Hoosiers with applications right away. Hoosiers interested in HIP 2.0 can visit online at hip.in.gov or call 1-877-GET-HIP-9 and see if they're eligible based on their income and family size. You know, nearly 35 years ago, President Ronald Reagan articulated a vision for American renewal driven by state-based innovation and reform. And that's just what Indiana's been doing. It's what we've done in education, in transportation, in tax reform, and now in health care. As the debates in Washington about the Affordable Care Act and Medicaid expansion continue, here in Indiana, we're reforming Medicaid. And hundreds of thousands of Hoosiers will have better access to quality health care as they aspire to a better life. When we announced HIP 2.0 last year, I recalled the long-cherished values of the people of our state. To remember the poor, to be willing to come alongside those who are struggling and not walk by on the other side of the road when our neighbors are hurting and in need. You know, that really is what makes Hoosiers special. You know, we know this is not about policies and programs, dollars and cents. This is about people. People like our family members, our co-workers, our neighbors, and our friends. They're hard-working Hoosiers who don't want a handout, but they could use a hand up. And that's what HIP 2.0 is all about. It's about respecting the dignity of every Hoosier, including our working poor, to find a way to cover themselves and their families, respecting their ability to make their own health care decisions and empowering them to lead better and healthier lives. HIP 2.0 is a better way to a better future for working Hoosiers, to better coverage, to a better health care system, and to a healthier Indiana.